Good vision is a key factor for living a healthy, happy life. The earlier we start looking after the health of our eyes, the better our chance of maintaining good vision throughout our lives. Vision problems can occur at any age, which is why regular eye examinations with an ophthalmologist are important. Good vision isn't just about seeing well, it's about living well. One such eye affection is glaucoma. Glaucoma is a group of eye conditions that damage the optic nerve, which is vital for good vision. Worldwide, glaucoma is the second leading cause of irreversible blindness. At Medicircle, we're conducting an awareness series on glaucoma with eminent ophthalmologists for the World Glaucoma Day to boost awareness and educate people about eye health. Hi, this is Sana Khan, and today in this initiative, we're going to speak to Dr. Vaishal Kenia. Dr. Vaishal established his private practice over 15 years ago. The success of a humble start has now blossomed into a state-of-the-art tertiary eye hospital, Kenia Eye Hospital, which has its motto to provide best, comprehensive, and affordable eye care under one roof. Dr. Vaishal Kenia is an executive board of the Bombay Ophthalmologist Association and is also a member of several other medical honor societies. He has also been a guest speaker at various conferences and seminars across the globe, always been innovative and brought the latest and best eye treatments from overseas. He holds a unique distinction operating on 50 single-eyed patients for cataract surgery in one day. Hello, Dr. Vaishal. Welcome to Medicircle.
Hey, hello from my side. And this is a very good initiative brought about by Medicircle. I appreciate its gesture. And certainly this talk, I think, would definitely give a message to the public that how important it is to be aware about glaucoma. Certainly. So
Certainly.
you can pitch your first question, ma'am.
Sure. Dr. Vaishal, how frequently should one visit an ophthalmologist and what are the best preventive measures for eyes?
Very well said. What I would say is that usually we ask, I would divide it into different age groups.
Okay.
For example, in the school-going age group, they have different sets of eye problems. Like today, the school-going children, as you know, because of this COVID lockdown, they are more glued down to the screens. Right. And that's why dryness in their eyes and also an increase in their spectacle numbers is on a rise.
Right.
So they should get their eyes checked at least every 6 months. What is happening in their eyes is very, very pertinent just now. When the screen usage was not that much, we would have said every year. But now, with so much of screen usage, the schools going digital, we would certainly ask them to get their eyes checked every 6 months.
Okay.
Today, the other class of individuals are the working class, going to the offices. Again, today the world is going digital. Right. All of our work is now on the laptops, on the desktops, on the mobile phones. So again, dryness of the eyes and eye-related problems are increasing. So even those people who are the young age group between 20 years of age and 45 years of age, they would have dryness of the eyes and they need to get their eyes checked. Because if you are in front of the computer, even for more than 4 hours, there is a very high chance of developing meibomitis or evaporative dry eye disease. So this, many of us are not aware of. And in this time when the COVID is there, when the offices have gone virtual, the hours spent in front of the laptops and the desktop has exponentially increased. And the eye problems have also exponentially increased. So what people really need to do and what not has to be done has to be, an eye expert can only tell you what all can be done for this. And getting your eyes checked is very, very important. Now, the most important age group is above 45 years of age, when age-related problems set in, when diabetic or hypertensive related problems set in, when glaucoma related problems set in, So we would always ask these individuals to get their eyes checked once a year again. The whole idea of getting your eyes checked is to catch the disease early. The more early you catch the disease, the damage done to the eyes is less. And the another unique point about the eye is that it is the only organ in the body where you can directly see the blood vessels. So diabetes and blood pressure, they affect the blood vessels. So here you can literally see what damage they have done to the blood vessels. When you do a retinal examination of these individuals, you can come to know what other damages occurred in the kidneys, in the heart, in the brain, just looking at the changes occurring in the retinal blood vessels. So definitely it is imperative for all age groups to get their eyes checked, because now we are going more virtual, our screen time has increased, and also because of sedentary lifestyle, our food habits have changed, our exercise, our diet, our so there is an increase in obesity, increase in diabetes, increase in hypertension, which is taking a toll, no, definitely on the eyes but also on the body. So all these reasons tell each and every one to get their eyes checked once. The another thing which I notice is people say we got our spectacles checked by the optician. But getting your eyes checked or spectacles checked by an optician is not a complete eye checkup. Because an optician just checks your eye number. But there is more to an eye examination. An eye surgeon would check not only your eye numbers, he would dilate your eyes or put drops in the eyes and dilate your pupils and check into the retina. He would check everything from the front portion of the eye to the back portion of the eye. So a thorough examination is done. So mind you, getting your spectacles made by an optician does not, it's not a complete eye checkup completely. So you may be falsely under the notion that my vision is absolutely fine and my eyes don't have disease. But this is the biggest myth. The earliest diseases do not affect the vision. For example, glaucoma does not affect the central vision. It affects the peripheral vision or the side vision. And slowly, when the glaucoma reaches its severe stage or end stage, that is the time when the center vision is affected, and then the patient comes to know. So to my mind, if you want to catch the disease early, you have to get a prophylactic annual eye checkup done with your eye doctor. And with the prescription given by the eye doctor, you can go to the optician and get your glasses made.
Okay, Dr. Vaishal, what food to avoid if one has glaucoma?
Fine. So particularly, there is no food cited which should be avoided. But what I would say is that certain yoga asanas have been told should not be done, like sirsasana or anything where there is an increased blood flow to the your head portion. So with an increased blood flow, there is an increased rise in the pressure. Second is binge drinking. It may be any liquid. It may be a beer or a whiskey or maybe just a simple drinking water. If you drink water, it should not be binge drinking. What do I mean by binge drinking is, at a time you should not binge and drink at least a liter of water at a time. If you want to drink, you drink a sufficient quantity of 1 glass at a time, or not more than 2 glasses, because the 1 glass is roughly around 250 ml.
Right.
So binge drinking has also been found to increase or worsen glaucoma. The third thing which comes to my mind is, wearing neckties which are very, very tight collars. Tight collared neckties would increase the pressure in the blood vessels in your neck, which would give a back pressure to your eye, and this would also increase your eye pressure. So these are certain things people who are having glaucoma should avoid doing certain asanas or certain postures while exercising. Second, avoid binge drinking. Third, avoid any tight collars or tight neckties. That could be precipitate or risk glaucoma further.
Can glaucoma be treated without surgery?
Yeah, certainly it can be. And to answer one more point, is marijuana has been found to control glaucoma. So there are now drugs being developed for which are derivative of cannabis.
Okay.
Cannabis marijuana is officially used as drugs in certain parts of USA at the moment, but
Okay.
slowly and slowly a group of eye drops would be coming in, which would have cannabis, which would control the glaucoma. But as of now, today the mainstay of treatment depends on the type of glaucoma. What type of glaucoma you have?
Okay.
What severity of glaucoma do you have? Do you have a mild disease? Do you have a moderate disease or a severe disease? So let me tell you, the first thing is to diagnose glaucoma. So unless you go to an eye doctor, the eye doctor is the person who can catch your glaucoma.
Right.
No matter whatever you do, glaucoma 90% of the time does not have symptoms, and you may harbor glaucoma and you may not know about it. So getting yourself checked by an eye surgeon at a regular interval of time is the first thing to do. So once we have a suspicion about glaucoma, we do certain confirmatory tests. These confirmatory tests are like visual perimetry, which checks your field of vision. We do an optic nerve analysis, which checks your nerve fiber layer thickness, and we do a gonioscopy by which we come to know whether you have a primary open angle glaucoma or a primary narrow angle glaucoma. So depending on the type of glaucoma, your treatment protocol or the algorithm depends on. So suppose, for example, you have a primary narrow angle glaucoma, then the first line of treatment is laser. We do a YAG laser iridotomy. So lasers can be the first line of treatment, and that could help you. In open angle glaucomas, definitely even selective laser trabeculoplasty can be done, or again, eye drops can be used to control glaucoma.
Right.
But if you have a very severe end stage glaucoma, your eye doctor may decide to go in for a more aggressive treatment.
Okay.
A treatment where surgery is required. Surgery namely involves trabeculectomy or glaucoma valve. Depending again on your type of your glaucoma disease, the surgery type would be decided. So what I would tell the lay people is, first and foremost, get your eyes checked. If your doctor feels the suspicion of glaucoma, he would run a battery of tests to confirm the diagnosis of glaucoma. And once your diagnosis of glaucoma is confirmed, depending on whether you have mild glaucoma, moderate glaucoma, or severe glaucoma, the line of treatment would be decided. No two people having glaucoma can have a same treatment. Each eye is unique, and each one would have a customized treatment depending on the type of glaucoma, the severity of glaucoma, and the personality type. Means whether the patient is meticulous, disciplined to follow up. Sometimes the patient are not very disciplined.
They're very ignorant.
Regularly.
Right.
Right. Then in such cases, we would ask the patient that since you are not very diligent in putting the eye drops and your glaucoma is not getting controlled, so in those cases also we would go in for a surgical line of treatment. So depending on the type, depending on the severity, and depending on other risk factors which the patient is having, the treatment would be prescribed, and it would be a customized, personalized treatment for each individual.
Right. Okay, Dr. Vaishal, is there no cure for glaucoma? Is this a myth or a reality?
Fine. So what we do with glaucoma is, just now, glaucoma, there are several genes being attributed to glaucoma, and glaucoma is a spectrum of disease. Okay. So there are various types of genes, and there is no single one gene loci by which we can give a genetic treatment and cure this disease. What are we doing at the moment is we are controlling the disease and asking the patient to modify his lifestyle if there are certain risk factors involved. So at the moment, definitely the main line of treatment is to detect glaucoma early. If you have any member having a glaucoma in your family, then the other siblings would be asked to get their eyes checked to detect whether they are having glaucoma or not. Or if your parents are having glaucoma, we would ask you to be more careful and get your eyes checked even after 35 years of age. So definitely today we are able to control glaucoma in a very well fashioned way, because the drops which we have, the eye drops, the medications are quite good. And believe me, if you meticulously follow the advice given by the eye doctor, no one goes into blindness. If we were to see today, glaucoma is around 1.25 crore people are having glaucoma in India. This is the 2020 statistics of India. So glaucoma blindness is a reversible blindness, and it comes as a third number in the cause for blindness. So this is the third biggest cause for blindness, glaucoma. And this is a blindness which can be controlled and it cannot be reversed. But definitely whatever damage has occurred won't reverse, but what further damage can be curtailed is curtailed with it.
The conditions
so
can be improved.
Glaucoma, yeah. So after whatever glaucoma of 1.25 crores is there, around 10% of the population of which is totally blind. So that is the very poor thing, or which is painful thing to know, that 10% of population who's having glaucoma is blind. We want to decrease this figure by creating awareness amongst the lay public by getting their eyes checked early.
Thank you so much, Dr. Vaishal, for coming to our show and sharing your valuable time and insights with us. It has been a pleasure having you on the show.
I hope this, whatever we have shared today, would be beneficial to the lay public. And definitely, if anything, they have any queries or anything they can address to me on www.keniaeyehospital.com, I would be grateful to answer them back. Thank you so much.
Thank you.
Thank you, Medicircle, for having me for their talk. Thank you so much.
Thank you, Dr. Vaishal. Have a good day. Bye-bye. Take care.